Hello, I'm Aditya Kapoor, and today we're talking about a patient, a young boy, in whom we had to perform a revision ACL reconstruction along with meniscal repair and a procedure called as lateral extra-articular tenodesis. And I'll very quickly take you through this. So this young chap had his ACL reconstruction, and unfortunately, soon after surgery, the ACL failed again. He came to us about 4 years after the original surgery, and when I examined him, his knee was considerably unstable. The MRI showed a ACL re-tear as well as a bucket handle tear of his shock absorber, the meniscus. So we performed a surgery where we have repaired the meniscus using sutures, as well as we have reconstructed his ACL. When we scoped him, I found that the original tunnels were a little non-anatomical and it had torn completely again. However, because of the previous ACL reconstruction, he had holes from where the previous surgery was performed, and we had to compensate for these while placing the graft using an all-inside technique. We have also taken a peroneal tendon for him since his hamstrings had been used before. We often do ACL revisions with peroneal tendon, and this has proven to be a good, strong, reliable graft. Additionally, because it was a revision and he had considerable instability, we performed a procedure called as lateral extra-articular tenodesis. In this, a small incision is made after the ACL reconstruction, and we take some tissue from the bottom, turn it up and put it in the femur with an anchor. Post-surgery, he has recovered exceedingly well. We have considerable experience with ACL revisions and our patients are doing well.
Hi, I'm Dr. Manideep Reddy. Today we have a 22-year-old male patient with us. He had his ACL surgery done 2021 somewhere else in other hospital. After that, after 1 year of the surgery, the ligament was torn again. Since then he has been suffering with the re-tear and instability. He had come to us for the second surgery of Revision ACL Reconstruction. On examination, we found out there was a grade 3 of pivoting. So we had to go for Revision ACL Reconstruction along with lateral extra-articular tenodesis procedure. Okay, listen in his own words the experience with us and how he felt after the surgery.
నేను 4 years బ్యాక్ వేరే హాస్పిటల్లో ఆపరేషన్ చేయించుకున్నాను. ఏసీఎల్ అండ్ మినిస్కస్ టియర్ అయింది. అయితే చేయించుకున్నాను, అంత బాగానే ఉండేది. 1 yearలో మళ్ళీ రీటేర్ అయింది ఏసీఎల్. సో ఇలా కంటిన్యూ అయ్యి ఇప్పుడు సార్ వాళ్ళ దగ్గరకు వచ్చాను, ఆదిత్య కపూర్ సార్, ఒమేగా హాస్పిటల్. సర్జరీ ప్రొసీజర్ అంతా ఎక్స్ప్లెయిన్ చేశారు. సర్జరీ అయింది, 3 days అవుతుంది, బాగా చేశారు. అంతా ఆఫ్టర్ ప్రీ ఆపరేషన్, పోస్ట్ ఆపరేషన్ అంతా ఎక్స్ప్లెయిన్ చేశారు. ఫిజియోథెరపీ ఎలా చేయాలి అంతా బాగా చెప్పారు. ఇప్పుడైతే ఏం ప్రాబ్లం లేదు, పెయిన్ కూడా ఏం లేదు. ఐఎమ్ హ్యాపీ విత్ ది ఎక్స్పీరియన్స్ అండ్ థ్యాంక్ యూ.